This is Christine Porter with the Times News. I'm talking with Dr. Shahzad Khan about tests used to diagnose Alzheimer's disease. He's a neurologist with Lehigh Valley Health Network.
So what tests are used to diagnose Alzheimer's?
Unfortunately, at this point, there is no single test which can be helpful to diagnose Alzheimer's disease. The basic goal for the physician is to look for any treatable cause for memory impairment. As I mentioned above previously, then they usually look for certain diseases. Even simple blood tests can be helpful to look for electrolyte abnormalities, thyroid problem, infection in the brain, all the scanning of the brain. So this is the initial testing a physician usually order whenever they see a patient for the memory impairment. If they did not find anything, they may decide to get help from a neurologist. And a neurologist, when they see those patients, they may decide to do some cognitive testing or neuropsychological evaluation. That evaluation can include like 5 to 10 minutes of interview to assess function of the memory, attention, orientation, comprehension, language, or they may decide to get another help from neuropsychologists, which can involve an interview lasting for up to 4 hours. Your neurologist may decide to order even more extensive testing for the brain, which can include MRI of the brain or a PET scan, which is usually reserved for the research purposes only. After all these evaluation, the diagnosis of Alzheimer's dementia is based on clinical assessment and neurological or neuropsychological evaluation. Fortunately, nowadays, a lot of research is going on, and investigators are trying to find a simple blood test to help to diagnose Alzheimer's disease. And we may be able to hear good news in next 1 or 2 years that we have a blood test available to diagnose a dementia or Alzheimer's type of dementia. People also do spinal tap, but it is done only for research purposes, not for a common day-to-day practice. So basically, Alzheimer's disease is diagnosed on the basis of initial clinical evaluation as well as neuropsychological evaluation and doing multiple blood tests as well as imaging study of the brain.
Thank you to everyone for joining us at home. And for more health tips during the COVID-19 pandemic, please visit the Lehigh Valley Health Network news blog at news.lvhn.org.